In this video, I'm going to go over the anatomy and physiology of the shoulder joint, as well as the biomechanics as it relates to fitness and rehab. The shoulder is a ball and socket joint, which allows it to move freely in all three planes of motion, and it's helped stabilize mainly by muscular attachments, including the subscapularis, supraspinatus, teres minor, infraspinatus on the back of the shoulder. These four muscles comprise the rotator cuff, which help with stability of the shoulder. Other muscles include the brachialis, triceps, which has three origin points and attachments at the olecranon, the biceps brachii, which has two attachment points, and then the bigger deltoid, which covers the entire shoulder region. The shoulder joint has minimal ligamentous connections, meaning connective tissue that connects bone to bone. And this is because it is a mobile joint. It's a ball and socket joint, which allows for motion in all three planes of motion. And if we didn't have this, it would be harder for humans to use the shoulder joint for tasks such as overhead mobility, reaching, and things that we do every day. As a physiotherapist, some common trends I see as it relates to rehab and fitness of the shoulder joint is weakness in the posterior shoulder musculature. This includes the infraspinatus, supraspinatus, teres minor, teres major, and the rhomboid musculature. There are a myriad of exercise options when it comes to strengthening the posterior shoulder musculature, from body weight to dumbbells to barbells, and it is the job of the clinician that you are working with to cater the exercise to where your fitness needs are. Another common problem I see as it relates to fitness as a physiotherapist is decreased overhead mobility of the shoulder joint. Now, there are three main reasons that I feel that contribute to this. The first being a joint restriction. So you have the articular surfaces of the humerus and the scapula, and there can actually be some restriction when it comes to the rolling and sliding motions of the joint. The second cause that I feel that contributes to decreased overhead mobility of the shoulder joint is a muscular restriction. Now, this can be due to poor flexibility in muscles such as the lat, which need to be able to have good flexibility to raise the arm overhead, or you can have poor shoulder stability in muscles of the rotator cuff, which stabilize the shoulder as you raise it overhead. And lastly, the third cause that I feel like contributes to decreased overhead mobility of the shoulder joint is impaired thoracic spine mobility. Thoracic spine is this mid-spine region, and you have to have a little bit of extension in order to have good shoulder mobility, particularly with lockout movements overhead. There are several exercise options to increase thoracic mobility. These can be implemented in the warm-up or right before your lifts.